Hello, I'm Bailey Gilbert.
I'm Olivia Johnson.
And I'm Morgan Fialik.
And we are senior nursing students at Davenport University here to talk to you about blood pressure. Blood pressure is defined as the pressure measured in millimeters of mercury within the major arterial system in the body, according to Cleveland Clinic. It's something that's checked every time you go in for a primary care appointment or into the emergency room for any reason. Blood pressure can be a big indicator of wellness or illness. The significance of keeping blood pressure in normal range is that it results in appropriate blood flow to the various organ systems within the body. Blood flow to the brain keeps it functioning at its greatest capacity and keeps the body moving. It's also required to appropriately perfuse our kidneys to help form and excrete urine. As the kidneys are forming and excreting urine, wastes are leaving and a fluid balance is created in the body. It's also required for the formation of lymph. Lymph is important for health because it helps with nutrient exchange to the tissues and cells and can help to protect your body from foreign invaders like bacteria, cancerous cells, or viruses. And finally, it plays an important role in the exchange of nutrients and gases in the body. So we understand that blood pressure is measured by the force of the blood against the walls of the vessel in your body, but there are many factors that can affect changes in blood pressure. To understand how blood pressure numbers can fluctuate, we have to look at the equation of cardiac output plus peripheral resistance. Cardiac output is affected by both the heart rate, or number of beats per minute, and stroke volume, which is the amount of blood pumped out of the heart with each beat. The heart pumps out blood into the body's vessels. Blood pressure increases when there is an increased volume of blood in the body and decreases when the blood volume is decreased. It increases when there is increased stroke volume and decreases with decreased stroke volume. This means that if a person is bleeding very heavily, their blood pressure will decrease. To see an example, with congestive heart failure, it is common to see increased blood pressure because fluids are being retained in the body and there's increased fluid volume. Another reason that blood pressure can be affected is resistance. When there's more resistance in the vessels, there has to be increased pressure to continue the flow of blood through the heart and throughout the entire body. This results in increased blood pressure. Back to the heart failure example, we see less elasticity in narrowed vessels in patients with congestive heart failure, which results in increased workload to push the blood through, resulting in increased blood pressure. This equation and explanation also shows why good nutrition can be a great lifestyle change to help control blood pressure. Patients with hyperlipidemia, or high cholesterol in the blood, can have a buildup of plaque that deposits into their vessels, which results in increased resistance and a rise in the blood pressure. Understanding how blood pressure is determined can help to understand how lifestyle changes and medications can work to control it.
There are several indications for obtaining blood pressure. Some of these indications can include monitoring your current clinical health status, screening for hypertension and hypotension, obtaining an estimate of your cardiovascular risk, determining the risk of certain medical procedures performed, and monitoring the effectiveness of the management of blood pressure, including blood pressure medications, lifestyle changes, and dietary adjustments. To measure blood pressure, there are certain items that are needed for this procedure. For an automatic blood pressure reading, a blood pressure cuff is needed along with an automated device. This can either be a small device attached to the cuff or a monitor depending on where the blood pressure is taken. For a manual blood pressure, a blood pressure cuff along with a stethoscope is needed. A manual blood pressure cuff will have a pump as well as a gauge. There are some important considerations before obtaining a blood pressure. First, it is important to ensure that the proper sized cuff is used when obtaining the blood pressure reading. Improper sizing can result in an inaccurate blood pressure reading. There are different sized cuffs, including a small adult, and large adult size. There are also cuffs made for the thigh of an adult as well, so it's important to ensure the cuff used is the right fit for you. It's also important to ensure the cuff is positioned correctly and in the right place. The cuff should be tight enough to fit 2 fingers under the edge of the cuff. The cuff should be placed on your arm 1 inch above the bend of your elbow. The tubing of the cuff should fall in front and center of your arm. Inaccurate placement can result in inaccurate measurements. Second, it is important to ensure that there has been no consumption of alcohol, no exercise, and no smoking within the last 30 minutes before obtaining your blood pressure. If these have occurred, it's important to allow the appropriate time to pass and then obtain the blood pressure. Third, it is important to make sure you are calm and have little or no anxiety. Some individuals become extremely anxious when at the doctor's. This anxiety can lead to a spike in their blood pressure. This is called white coat syndrome. A study was conducted which found the overall prevalence of white coat syndrome in the general population to be 10 to 15%, and it amounts to about 30% in patients with increased clinic blood pressure readings. By helping reduce your anxiety, this can help prevent an increase in blood pressure readings as well. Lastly, it is important to ensure that the procedure is fully explained and any questions are answered prior to taking the blood pressure. Not only does this help reduce anxiety in the patient, but it also helps to build a trusting relationship with the individual taking the blood pressure. It is also important when taking blood pressure that the individual getting their blood pressure taken should have their feet flat on the ground and their arms should be resting even with the heart. When legs or feet are crossed, this can result in an inaccurate high blood pressure reading. Additionally, if the arm is too high or too low, it can result in an inaccurate reading. It is also important to ensure that the equipment is functioning properly and does not need to be replaced.
Annual blood pressure is measured using a stethoscope and a blood pressure cuff. Once the cuff is securely wrapped around the extremity and the stethoscope is placed approximately over the artery being auscultated, then the blood pressure can be measured appropriately. This is done through the auscultation, otherwise known as listening, of the carotid cuff sounds. As compression is released from the blood pressure cuff around the arm, this generates the 5 different sounds that you will hear as blood passes through the brachial artery. Phase 1. The first carotid cuff sound is known to be a faint, yet sharp and clear tapping sound that increases with intensity as the blood pressure cuff is released. This first sound heard is what also defines the systolic pressure. Phase 2. The second carotid cuff sound is heard as a whooshing or swishing sound that is a dampening of the sound from phase 1. Phase 3. The third carotid cuff sound is a soft, thumping sound that is less intense than the sharp tapping heard in phase 1. Phase 4. The fourth carotid cuff sound is a well-defined, muffled sound that gradually fades into a soft, blowing sound. And finally, phase 5. This is the absence of all sounds of blood flow, and this defines the diastolic pressure. Relative contraindications of taking a blood pressure, along with absolute contraindications. Relative contraindications mean the blood pressure should be avoided being taken on that extremity, but if need be, that extremity can be used. Absolute contraindications mean that no matter what, the blood pressure cannot be taken on that side and extremity. Some of the relative contraindications of blood pressure would be if you have lymphodedema in the affected extremity. Another contraindication is if you have paralysis or paresis in the affected extremity, such as having a stroke that resulted in the loss of functioning in one side of the body. And lastly, if you have an arterial or venous line in place, which prevents potential damage to the catheter and the catheter site. Some of the absolute contraindications of taking a blood pressure would be if you're on dialysis and they have a fistula in the affected arm placed. If you have a recent surgical wound or incision on the affected extremity. And finally, if you had a mastectomy, this is contraindicated on the side that you had the mastectomy on. This next slide covers the blood flow through the heart. This picture seen right here goes through a brief description of the flow of blood through the heart and all the way back into the body. So, although this process may seem simple, the flow of blood through the heart is a complex process with several steps along the way. As blood flows through the heart, it goes through several valves and chambers before it is fully oxygenated and is eventually distributed to the rest of the body. To begin, deoxygenated blood from the body enters the heart through 2 large veins, the inferior vena cava and the superior vena cava, as shown in the picture. These veins bring blood from the upper and lower body and empty directly into the right atrium. The tricuspid valve opens to allow the blood to move to the right ventricle. The right ventricle will squeeze when it is full of blood and causes the tricuspid valve to close, and the pulmonary valve will open. Blood will flow into the pulmonary arteries, which will bring the deoxygenated blood to the lungs. In the lungs, the blood will become oxygenated and will release carbon dioxide. After the blood becomes oxygenated, it will travel through the pulmonary veins into the left atrium. The mitral valve will open and the blood will go into the left ventricle. After the left ventricle is full of blood, the mitral valve will close and the aortic valve will open. This will bring the blood to the aorta, where the blood will travel to the rest of the body and bring oxygenated blood. After the blood circulates the body and becomes deoxygenated once again, the inferior and superior vena cava will bring the blood from the body back to the heart, where the cycle will repeat all over again.
The systolic pressure is the top number on the blood pressure reading. This represents the peak arterial pressure that occurs during systole. The systolic pressure also represents phase 1 of the carot sounds, along with the contraction of the valves as the heart works to pump blood out of the body. The diastolic pressure is the bottom number on the blood pressure reading. This represents the minimal arterial pressure that occurs during diastole. Diastole is a relaxation of the valves in the heart after the ventricular contraction. When the heart relaxes, it allows the chambers of the heart to fill with blood. This represents the relaxation of the valves in the heart after the contraction is complete. The normal range for blood pressure is less than 120 for the systolic pressure and less than 80 for the diastolic pressure. There are several different factors that can result in low or high blood pressure. Some of these factors include an improper fitting blood pressure cuff or wrapping the blood pressure cuff around clothes rather than directly against the skin. If you consumed caffeine or alcohol, smoked, or used nicotine products or have exercised in the last 30 minutes of obtaining your blood pressure, talking or listening to someone while having blood pressure taken, certain medications such as diuretics, narcotics, NSAIDs, decongestants, antidepressants, birth control, and immunosuppressants, as well as stimulants. Taking the blood pressure when the arm is raised above heart level, consuming an unhealthy diet, but especially a diet that is high in sodium or cholesterol that can cause an increase in pressure, extreme emotions such as high anxiety and stress, several chronic conditions and diseases such as Parkinson's, diabetes, heart failure, chronic kidney disease, hypo and hyperthyroidism, sleep apnea, and others. Illnesses and infections can lead to hypo and hypertension, depending on the infection or illness present. Transfusion reactions from a blood transfusion can cause a sudden spike or drop in blood pressure. Pregnancy is a major cause of high blood pressure. Having a full bladder while your blood pressure is being taken can cause an increase in blood pressure readings. And obesity is associated with several health conditions, one of those being hypertension. Eating disorders are also known to have the opposite effect on blood pressure, causing hypotension.
Blood pressure can be associated with several signs and symptoms. Some of these signs and symptoms associated include blurred vision, dizziness, lightheadedness, fainting, fatigue, trouble concentrating, and nausea. There are several causes of hypotension. Some of those include medications, shock, and infections. Low blood pressure causes your heart to have to work harder to properly perfuse your organs and tissues, and long term, this can have issues. It's important that when hypotension is identified, it's treated quickly to prevent additional complications. Some of the methods of treatment for hypotension include sodium consumption that results in water retention, leading to an increase in your blood pressure. Likewise, increasing your fluid intake can also increase your blood pressure. Applying compression socks can be another effective method of treatment to increase your blood pressure. And lastly, medications are a very effective method, as all other methods are not effective in increasing your blood pressure. This can be a last resort. Some of these medications include midodrine and fludrocortisone. Low blood pressure can be a chronic and long-lasting condition as well. For some people, low blood pressure spells come with position changes, nutritional deficiencies, or infection. Medications can be taken to control the symptoms of low blood pressure, like dizziness, headaches, or blurred vision. As mentioned before, fludrocortisone and midodrine are two common medications. Some common brand names that you may have heard of low blood pressure include Orvatine, Promethazine, or Florinef. These medications are able to raise blood pressure by increasing the vascular tone, causing constriction of the blood vessels and raising their resistance, which in turn raises the pressure of the blood against the walls of the vessels, overall helping increase your blood pressure and reducing the symptoms of hypotension.
High blood pressure can be associated with several different signs and symptoms. Some of these signs and symptoms include recurrent headaches, fatigue, insomnia, vision issues, chest pain and discomfort, dizziness, nausea and vomiting, and heart palpitations. High blood pressure can become serious if this is a recurrent and long-term issue in your health. Thankfully, there are several different methods to help reduce blood pressure in your life other than medications. One method that is effective is by following a heart-healthy diet. This includes a reduction of sodium in your diet, reducing fluid intake, reduction of cholesterol, and equal servings of fruits and vegetables. Another method is just by reducing your sodium intake from food. Sodium is in several different food groups and can have a huge influence on your blood pressure. Water follows salt, so increased sodium in your body leads to an increased amount of water, causing an overall increase in your blood pressure. A study was conducted which found low sodium diet lowered systolic blood pressure in nearly 75% of individuals compared to those with high sodium diets. Additionally, regular physical activity incorporated into your daily routine can also cause a reduction in your blood pressure. This also helps you maintain a healthy weight and BMI, which is another method of treatment. Another important method of treatment is to refrain from smoking. Nicotine is the main ingredient in cigarettes, and this stimulates the release of epinephrine and norepinephrine, which results in increased blood pressure. Refraining from smoking and limiting alcohol intake will help lower blood pressure because both will increase your blood pressure. Making these lifestyle changes allows for maintenance of normal blood pressure. There are some common medications doctors may prescribe for high blood pressure. Diuretics are a medication that helps remove salt and water from the body. There are different classes of diuretics that include loop, thiazide, and potassium sparing. Your doctor will decide the class of diuretic based on your health history and assessment. Hydrochlorothiazide is an example of a thiazide diuretic. One common side effect of a diuretic is increased urination. Another medication commonly prescribed are ACE inhibitors. These relax the blood vessels. An example of an ACE inhibitor is lisinopril, and a common side effect of these medications are a dry cough. Calcium channel blockers can also be prescribed for high blood pressure as they relax the muscles of the heart and vessels. Amlodipine is an example of a calcium channel blocker. When taking a calcium channel blocker, you should not drink or eat grapefruit as it can have a dangerous effect on the body. A common side effect of this medication is constipation. Another medication commonly prescribed for high blood pressure is beta blockers. This type of medication can be used to treat high blood pressure because this medication works by decreasing the workload of the heart and also widening the blood vessels. This will allow the heart to beat with less force and at a slower rate. Metoprolol is an example of a beta blocker that is commonly prescribed for high blood pressure. Fatigue and lightheadedness are common side effects of beta blockers. The American Heart Association categorized the different stages of hypertension. The first category is elevated blood pressure or pre-hypertension. Blood pressure is considered elevated when the systolic reading is 120 to 129 and diastolic is less than 80. Elevated blood pressure is not a health condition like hypertension, but just rather a blood pressure category. However, elevated blood pressure can worsen over time and can develop into hypertension. With an elevated blood pressure, the American Heart Association recommends a recheck in 3 to 6 months. The next stage is the first stage of hypertension. In stage 1, the systolic pressure ranges from 130 to 139, or the diastolic ranges from 80 to 89. With this first stage of hypertension, the American Heart Association recommends a heart disease and stroke risk assessment. If there is a less than 10% risk, then they recommend a recheck in 3 to 6 months. If the risk is above, then they recommend lifestyle changes, medications, and monthly rechecks until the blood pressure is managed. The next category is stage 2 hypertension. In stage 2 of hypertension, the systolic pressure is 140 or higher, or the diastolic pressure measures 90 or higher. With stage 2 hypertension, the American Heart Association recommends lifestyle changes and 2 classes of antihypertensive medications. They also recommend monthly blood pressure rechecks until it is managed. And the final stage is the most serious stage of hypertension. This is known as a hypertensive crisis. During a hypertensive crisis, the systolic pressure is above 180 and the diastolic pressure is higher than 120. A hypertensive crisis is one case that cannot wait, and if you are experiencing this, you need to contact your healthcare provider immediately. High blood pressure can have long-term effects on the body. This can cause damage to your arteries, which decreases the overall blood flow and oxygen to the heart and body. The American Heart Association claims long-term effects of hypertension includes an increased risk of developing coronary artery disease, stroke, vision loss, heart attack, end-stage renal disease or failure, sexual dysfunction, peripheral arterial disease, hyperlipidemia, heart failure, and angina.
So I'm sure everyone knows a neighbor, relative, or coworker who struggles with high blood pressure, but let's take a look at how prevalent it actually is in the United States. The Centers for Disease Control and Prevention and the United States Department of Health and Human Services has a blood pressure initiative called A Million Hearts. They are able to give more information about the prevalence of high blood pressure in the country. They say that nearly 119.9 million adults in the United States, which is nearly half of them, suffer from high blood pressure. Of those adults with high blood pressure, only 1 in 4 have it under control. The first treatment method, as earlier discussed, is a modification to lifestyle, including more exercise, healthy eating, and smoking cessation. For 1 in 5 diagnosed with hypertension, the only treatment recommendation is those lifestyle changes. For 4 in 5 adults, though, it is also recommended that they take prescription medications. The issue is that even with the treatment options of lifestyle changes or the use of medications, a large majority of people are unable to control their blood pressure. This is why it is so critical to focus on prevention before it becomes an issue, or focus on treatment through living a healthy lifestyle and taking medications as prescribed. We can also take a look at prevalence of high blood pressure in Michigan specifically, just to bring the numbers a little closer to home. A few years ago, in 2019, the Life Course Epidemiology and Genomics Division of the Michigan Department of Health and Human Services determined that 35.1% of adults in Michigan had a diagnosis of hypertension or high blood pressure. There are also statistics that focus directly on mortality or death rates related to hypertension. For every 100,000 people in the state, there's 9.7 deaths related to high blood pressure. This means that there were 1,234 deaths related to hypertension in Michigan in 2021. This is a really concerning statistic that should be addressed with continued education and preventative care. So the map on the slide here shows mortality rates by state, with the darker red colors representing the states that have a higher rate of death per 100,000 people and the lighter colors representing lower rates of death. As we can see, Michigan shows up in orange, meaning they're in the middle of the road as far as mortality rates associated with hypertension. This is still something that we as citizens of Michigan should continue to focus on to make our state's population healthier. Understanding ways to improve and enhance your heart health can decrease the risk of high blood pressure and decrease its negative impacts on your body. The American Heart Association identified 10 ways to improve your heart health, as seen on this picture on the right side. It is recommended by the American Heart Association to complete moderate exercise for 150 minutes a week or vigorous exercise for 75 minutes a week. Alcohol should be limited and smoking should be avoided altogether. Focusing on daily nutrition requirements can help enhance heart health as well. It is recommended to have 2.5 servings of vegetables, 2 servings of fruit, 6 servings of grains, 3 servings of dairy, 5.5 ounces of protein, and 3 tablespoons of fats and oils each day. So as shown in the picture on the left, that is the heart healthy symbol. It's shown on food that has been deemed nutritionally adequate by the American Heart Association, and is something that assists the community in determining foods that adhere to a heart healthy diet. The American Heart Association has identified some heart healthy ideas for cooking and baking, as well as other easy sugar swaps that can help cut back on added sugar and calories. When cooking and baking, unsweetened applesauce or a no-calorie sweetener can be used in place of sugar. Another consideration when cooking is dressings and sauces, as they contain added sugar. By making homemade dressings and sauces, this allows you to control the sugar and the ingredients you're putting in them. You can also make healthier choices by swapping out soda and soft drinks for sparkling water flavored with citrus, mint, cucumber, or even 100% fruit juice. Desserts and sweets typically contain sugar and preservatives. A healthier swap for desserts and sweets is natural fruit, which can be enjoyed fresh, frozen, canned, and contains all the vitamins and minerals. This can be prepared in many different ways, including baked, grilled, stewed, or poached. Snack mixing granola can also be packed with added sugar. Making your own can allow for a healthy snack that provides healthy fats, whole grains, and dried fruits. Lastly, you can make healthy swaps by cutting back on sugars in tea and coffee. Instead, you can add natural flavors like cinnamon, citrus, mint, or nutmeg to still add that sweetness. Blood pressure control is something that many people struggle with. The good thing is that there are many resources available that can help provide more information in addition to the video you were able to watch here today. The Michigan Department of Health and Human Services has a division called Healthy Hearts with a focus on cardiovascular health. It can help guide you on your blood pressure and what the numbers mean, provide dietary tips, provide more information related to insurance coverage of at-home blood pressure equipment, and many more topics related to decreasing the incidence of heart disease, heart attacks, and strokes. The American Heart Association website also has a plethora of information about blood pressure control and heart disease prevention if you're looking for more resources. We really appreciate you joining us today to learn more about blood pressure control and healthy practices.